Examination of cranial nerves 5, 6, 7, 8 by ENT student. Fifth cranial nerve is the trigeminal nerve. It has three divisions: ophthalmic, maxillary, and mandibular. Ophthalmic supplies the conjunctiva, upper eyelid and its conjunctival surface, lacrimal gland, medial part of skin of nose and forehead. Maxillary division supplies the lower eyelid and its conjunctival surface, upper lip, upper teeth, mucous membrane of nose, roof of mouth, upper part of pharynx, part of soft palate and tonsils. Mandibular division supplies the lower lip, lower teeth, tongue, supplies the parasympathetic fibers to salivary gland, and it's joined with motor root and innervates the muscles of mastication. Examination. Trigeminal nerve has both sensory and motor function. To assess the motor function, ask the patient to clench his teeth and feel the masseter and temporalis muscle of both sides simultaneously. If there is paralysis on one side, then the muscle will not contract. On asking the patient to open the mouth, the jaw will deviate towards the affected side, indicating there is paralysis of the pterygoids. To assess the sensory function, sensation over face is tested as it is supplied by all the three divisions. Keeping the patient's eye closed, ask him to protrude the tongue and apply salt or sugar on the anterior surface of the tongue and ask for the taste. Sneezing reflex and corneal reflex are tested. Examination of sixth cranial nerve. Abducent nerve. It supplies the lateral rectus muscle which helps in abduction of the eyeball. It is examined along with trochlear and oculomotor nerves which supply the superior oblique and rest of the ocular muscles. Ask the patient to look at your finger and then move the finger upwards, downwards, abduction and adduction. Seventh cranial nerve is the facial nerve. It has motor, sensory and parasympathetic function. Motor function is by controlling the muscles of facial expression and moderating the loudness of sound in inner ear. Sensory, the taste sensation from anterior two-thirds of the tongue via chorda tympani. Parasympathetic is by supplying submandibular and sublingual salivary glands and lacrimal glands. Examination. The motor function is examined by asking the patient to raise the eyebrow to see the function of occipitofrontalis, close the eyes tightly to see the function of orbicularis oculi, to blow the cheek and whistle to see the function of buccinator muscle and stretch the neck. Sensory function is assessed by putting salt, bitter and sour substances on one side of the tongue and then on the other side alternately. Tip of the tongue is sensitive to sweet, back of tongue is bitter and side of tongue to sour and salt. Electrogustometry is a better way to test taste sensation. Then the secretomotor function is assessed by Skirmer's test and salivary flow rate. In Skirmer's test, insert a elongated blotting paper of 0.1 mm thickness, 5 mm wide and 30 mm long under the lower eyelid and compare the wetting of the blotting paper after some time. A difference of greater than 90% is significant. Salivary flow rate. Place Carlson Crittenden cup over parotid duct after maximum stimulation by sucking lemon. Flow less than 0.5 ml in a minute suggests xerostomia. Examination of 8th cranial nerve. It is the vestibulocochlear nerve which has two sensory components. The vestibular nerve handles the balance and equilibrium which is examined by recording of nystagmus by caloric test and electronystagmography. The cochlear nerve is responsible for hearing which is examined by Rennes and Weber's test. Rennes test. The base of the vibrating tuning fork is placed firmly over the mastoid process. Patient is asked to indicate when the sound disappears and suddenly the tuning fork is placed vertically 2 cm from external auditory canal. If he still hears, air conduction is more than bone conduction, that is Rennes positive, seen in normal people. If he don't hear, bone conduction is more than air conduction, that is Rennes negative, conduction hearing loss is present. Weber's test. A vibrating tuning fork is placed in the middle of forehead or vertex and patient is asked in which ear sound is heard. Normally heard in both the ears. If the tone is lateralized to poorer ear, it indicates conductive deafness in the poorer ear. If the tone lateralizes to good ear, it indicates sensory deafness in the poor ear. This is how Rennes test and Weber's test are done. Thank you.